Hello, everybody. Welcome to another episode of Legacy Leaders. Today, yours truly is joined by Roberta Brofman of Five Star Clinical. She is the owner, the founder, and the self-proclaimed grand poobah of all things in her business. I say that tongue in cheek. Roberta and I have had some great conversations to date, and I will say delightful individual, um, as we say in certain circles, wicked smart, and has a tremendous capacity for patient and family service that I want her to talk about, explain what she does, and the value it brings to families, because this is one of the cornerstone problems that we're dealing with in healthcare. And believe it or not, Roberta has a phenomenal answer to it. And it's just a matter of being somebody of service. So, with that in mind, Roberta, I'm going to turn the microphone camera over to you, and you tell
Okay,
us all the wonderful things about Five Star Clinical and how it all came to be.
sure. So we provide expert nurse-led advocacy to help patients and families to navigate the very complex and broken healthcare system we live in. We help people to make decisions with clarity, with confidence, with information. We also partner with healthcare institutions. I don't know if I told you that to enhance
Hmm.
their communication, their care, and help them get to that five-star level. So, Scott, healthcare today often feels like a real maze. It's full of specialists, they're amazing specialists. We have tests, follow ups, yet we're really short on what matters to the individual. And that's understanding the person behind the patient and really listening to what they need. So, as a nurse patient advocate, I've seen firsthand what happens when care becomes too standardized, too rushed, when people don't
Hmm.
listen. And I've shared with you the story of how I became a patient advocate. I have many years of experience as a registered nurse, starting in intensive care. I've done home care, you name it, I've pretty much done it. And that gave me a great clinical background. So, about 5, 6 years ago, my husband went in for what was supposed to be an overnight surgery. And right away in the recovery room, I kind of felt like something wasn't right. He had a lot of IV fluids going in, he didn't have a lot of urine output. And I questioned the staff and they checked him out and they said, no, no, he's perfectly fine. We went up to the unit, and keep in mind, this is supposed to be an overnight surgery.
Hmm.
Went up to the unit, he sat up and he passed out. And I said to the nursing staff, I think he's bleeding internally. And they, no, no, he's fine. He's fine. Well, I'm giving you the short story, but he ended up developing tremendous bruising from his chest down to his knees, which is a classic sign of retroperitoneal bleed. Medicine came in and told us he was bleeding. Surgery came in. The resident came in and said, no, he's not bleeding. There's nothing wrong here.
Oh my God.
Finally, after about 5 days, the surgeon called me up and I said, I'm trying to think maybe he's got an underlying clotting disorder. I think he's bleeding. He could be a sitting duck for infection. And he quote unquote told me, why don't you stop thinking and just be a wife?
Ooh.
And even at the, I know, really insulting. And even at the time, I thought, well, maybe he's just trying to put me at ease. He doesn't want me to worry. But he didn't come in for like 6 days. And when he did, he's like, oh, everything's fine. He'll be home in a couple of days. Finally, I decided I'm done. I'm demanding he be transferred to the intensive care unit. They didn't even put their hands on him, and they immediately recognized he was in septic shock already, which means he had a
Oh.
massive blood infection. He was almost intubated. He spent a month in the intensive care unit. I stayed with him continuously. They went to look for the source of the infection in his abdomen and punctured two major arteries. He had to have, oh, it was it was a disaster.
Mm.
This was not Podunk Hospital. I'm not going to say where, but
Sure.
it was not
I
the
appreciate
small
that.
little hospital. This was a major hospital, and Cleveland, of course, is a mecca for healthcare. So it made me recognize at the time that had I not been there, and I will tell you, the senior resident even came down to me and said, "Don't take him to the ICU. You've got a beautiful room with a beautiful view, and the visiting hours are going to be restricted in the ICU." And I said, "Nope, absolutely not." So thank God, even if we had waited a few hours, I don't think he would have survived. He spent a month in the intensive care unit, another month at home with me taking care of him, IV antibiotics, catheters, drains, dressing changes. And thank God he is fine now. He works more than full time. But he was a runner when he went in, and he could barely walk
Hmm.
when he got out. So had I not been there and have the knowledge and clinical expertise that I have, and the ability to, walk that fine edge of advocating without offending, without
Hmm.
demanding, he would have died. And I think everybody would have said, well, isn't that strange? He was so healthy when he went in, maybe it was
Right.
just his time. So people don't, I always say you wouldn't go into a court of law without your attorney
Mhm.
unless you're kind of foolish or really, really good at legal things. Why would you go, excuse me, why would you go through situations where you don't understand the healthcare system without someone who's an advocate?
Yeah. And I appreciate you sharing the story, Roberta. And it can't be
Oh,
easy to retell, but I think what's nice is advocacy comes from experience, and your experience was one that drove you to be an advocate because it's not easy to go through what you went through, but it would be, and just knowing who you are, it'd be more difficult for you to continue doing whatever you do and not allow people to have the same access to you and your knowledge because they could easily be in the same situation your husband was in and not have somebody there helping them out. And
yeah,
I see you as somebody that's willing to speak for the family or the patient when clinical is just unwilling to communicate. And it's not by a malpractice. I don't want to say that necessarily, but it's because they don't communicate, they don't listen, and you're just a wife. What do you know? Right? So if you have an actual advocate that is credentialed and knows what they're doing, it's almost like they have to listen because you're bringing things up that they know and they can actually go investigate as opposed to brushing you off because what do you know? You're just a wife, right?
yeah. Well, and
It's
Scott, the
sad.
other thing is you don't know what you don't know. Right. I
Hmm.
remember when I started out as an ICU nurse, and one of the staff members that was orienting me when I first began said, "You're dangerous only because you don't know what you don't know." And that is what happens with people who you can be the CEO of, you can be Elon Musk and send rockets into space. I can't do that, but
Right.
Elon likely doesn't know how to manage. You don't know when things are going wrong, if there's something you should bring to their attention. So yeah, it's extremely important. And I think in defense of our physicians and our nurses, they're stuck in the same mess as
Hmm.
we are. We have great specialists, which is fantastic. But I have one client who has two cardiologists. Okay, same heart, two cardiologists. One cardiologist deals with his pacemaker. The other cardiologist deals with his heart failure, and they don't talk to each other, and they're in the same system. So
Mm.
I go to those appointments with him to make sure that everything is communicated back and forth. Oftentimes, I see patients who are on multiple medications, sometimes 20, 25 medications. And some of those medications are treating a side effect of another medication. But
Yep.
since we're so siloed, yes, they look at your med list, but sometimes it's wrong and people don't realize it.
Hmm.
I will tell you, when my husband and I went back to all the different specialists after he got, out of the hospital, same hospital setting, different doctors, they all had a different list of medications. They just varied just a
Jesus.
tiny bit. So had we not paid close attention to that, maybe they want to change a dose or maybe they want to put you on a new
Hmm.
medication. That's fine, but they need to understand exactly what you're on. And I can't tell you how many times, Scott, that I've heard people say to me, "Oh my gosh, I wish I had known you when my mom was sick or my
Yeah.
dad went to the hospital or went into nursing home."
Yeah. You're telling me this right now. And there was significant time with my mom in a very similar situation with medications. She was on COPD, rheumatoid arthritis, blood thinners, and the medicine, if it wasn't in the right dosage and she wasn't hydrated effectively, she would literally crash, right? But the three different doctors didn't know what the other two doctors were doing. So her
Yep,
medication soup that we gave her every day, it didn't make any sense to anybody until she was at Metro in the ICU for 10 days and they realized that this is not a good cocktail, that she should not
right.
be on this. And on the outside of it, okay, we didn't know. And I would love to have known somebody like you to help navigate those different courses and the different challenges because everybody is going to have this level of challenge and issue because not everybody's a clinician, right?
Yeah.
Mm,
Well, I call myself the quarterback of your care. If you think
I
about
like that.
the hub of a wheel, so you have all these different specialists around the wheel, and they're
Mm,
excellent, and I respect them. There's no question they are excellent at what they do, but they're rushed. I mean, most people,
yeah.
I've heard people say to me that they'll go into a physician office and they put a timer on 15 minutes. the timer goes off, and literally, not all doctors do this, but literally will say to the patient, I'm sorry, time is up. If you want to make another appointment, you can. Because I say they sold their souls to the devil because back in the day, you had kind of the Marcus Welby, if you remember that show.
Hmm.
This Marcus Welby who would, run out. They knew the whole family. They birthed the kids. They knew the kids, watched them grow up. They knew the whole family. They knew everything about you. We don't have that anymore. So they're just as frustrated because they said, instead of running a private practice and having to deal with all the overhead and scheduling and billing, we'll just work with the hospital or we'll work with a corporation that's gonna buy us out, and they'll deal with all that stuff, and I can just be a doctor, which is what I want to do. Well, that was a great idea, except for attached to that were some strings. You
Hmm.
need to see X number of patients per day. We're seeing a lot of direct patient care or DPCs starting, where they charge a small amount, maybe monthly, and then you have access to either the physician or nurse practitioner or both very quickly, like you did in the good old days, and also concierge medicine. But
Hmm.
that's costly, so you may have to pay $2,000-3,000 a year. You get an annual physical, blood work, that sort of thing is covered, and you pretty much can get a response from them quickly. But I remember days when I was a kid, and maybe I was sick. My mom would call my doctor. He would just pick up the phone right then,
Yeah.
even if he was with a patient. That doesn't happen anymore. So you really need somebody who has some knowledge and expertise and can intervene for you.
Yeah. I look at it as the note I wrote, you are the person that helps somebody navigate the machine that is healthcare without breaking down. And I would
Yeah,
imagine the breakdown is both mental, probably stronger than the physical side, and the physical nature of it. Because if you're a patient and you're in the machine, you need somebody, family member, or anybody else to be your advocate. And if your husband or wife is your advocate and they don't know anything clinical, how are they going to help you? So that's where
right.
you step in, right? Is you're this really nice liaison to help people understand how to go from what you're being told and what's actually happening. And sometimes it's not always going to align. So you need to step in and say, wait, your numbers or your data isn't matching up what I believe clinically. So let's take a look at this, right?
Right. I call
Yeah.
it bridging the gap,
Yeah.
bridging the gap in communication that we unfortunately are experiencing in the system. So yes, you're 100% correct.
So you've been doing this for a couple of years now. How long have you been doing it?
Started the company almost 8 years ago. In
Hmm.
January, I believe it'll be 8 years. Started initially as a clinical consultant, which I still do. So quality is extremely important to me. I believe if you're going to do something, you do it to the best of your possible ability.
Hmm.
And so I help organizations. That's why I started out calling it 5-star clinical solutions, because nursing homes, hospitals try to get to that coveted 5-star level. So state surveyors come in, Joint Commission comes in to hospitals and nursing homes, and they put them through a grueling process, at least
Yeah.
annually. And I have a lot of experience in dealing with that. So I can go in and do mock surveys, help them get to the level where they're providing the best possible care. And then, of course, that helps me on the other side, because if they're doing an excellent job, then my patients,
Yeah.
my clients, are getting great care. So oftentimes, if I have a client who's in a nursing home or needs placement, I can do that. But I also go to visit them at least monthly, either at home or in the nursing home or hospital. I can
Yeah.
attend physician appointments with them. For example, I had one lady, took almost an act of God to get her to the cardiologist, and an aide went with me. She had an aide 24/7. And we got there, and I'm in the room with the physician, and she had a pacemaker. And he said, well, you can come back, next month for your pacemaker check. And I mean, it took a lot to get her there. And I said, well, we can actually do that by the phone. And he goes, oh, yeah, you're right. We could. And, it wasn't that he was bad. He just
Just
didn't
didn't
think
know.
about that. And he wasn't the one that had to actually get her in the car, get her in the wheelchair.
Mhm.
He was like, oh, yeah, that's right. We could do that. No problem. So even those little things are huge. They're a big deal.
Well, you said it, it's like missing the little things is the essence of what you do, in that you want to make sure that the family knows the little things. And you want to make sure the doctor or a clinician is not overlooking the little things, right? When you
Mhm.
become an advocate. I love the idea
Yeah.
that you go back to your consultant work with hospitals and nursing homes, I don't know if people necessarily understand the rigors of Joint Commission. It's a governing body that allows ratings for different departments and overall hospital or overall healthcare and nursing home performance. And what they do is rather rigorous. I mean, when they come into town, it's almost as if things don't shut down, but things get on high alert and you're judged, right? So having
100%.
pardon me?
I said 100% you're judged. Yes, you're put through the ringer. And yes,
Yeah.
things kind of stop and we are at their beck and call.
Well, and when they're done, they give you a report. You have to fix things. You have so many days to do it. If you don't, they
Right.
literally will shut you down.
Yes.
So being somebody that has that level of background from a consultant perspective and the clinical background of what you've done, I believe that makes you the perfect nurse patient advocate because you know both sides of that equation, right? You understand the clinical side, how to take care of a patient, and you understand the political and administrative side because you know what Joint Commission is looking for. So you can actually tell somebody if you're not doing the right preventative protocols and you're not having the right amount of prophylaxis or anything else with a patient, you're missing the boat. And this is what we're looking for our patient. Then there's a
Right.
connection between you, the clinician, and the patient. That's what I think is so interesting about what you do, is it's not just one layer of I'm a patient advocate, I'm also a consultant. They work so hand in hand together because one begets the other and allows you to be better at
Yes.
the other.
Yes. Well, and I think to your point, Scott, I also understand what it's like to be that nurse who's trying to pass medications and has 25 medications per patient and has
Mhm.
40 patients or 30 patients today in their nursing home. And here comes a daughter who's irate because she believes that mom isn't being properly taken care of. So I get what it's like to be on both sides of that coin. I've been a director of nursing, I've been a vice president of clinical services. I understand both sides of that. So when I approach a clinician, a physician, a nurse, I understand where they're coming from and I understand the stresses they're under and how to present a problem or a concern.
Yeah.
Which you've got to start with a little bit of honey, as Dale Carnegie used to say. You're going to get further if you can get on their side and understand. Yes, I'm there for the patient, but I also understand what that nurse is going through and how frustrated or that doctor is when you're
Yeah.
approaching them.
And coming from an understanding of compassion and attention to solving a problem is a really interesting way that you come about your business compared to others that are literally when everything is when you're a hammer, everything looks like a nail, right? You have a completely different approach to it because every situation is different and unique. And you can't, for instance, you can't be an OBGYN or the maternity ward and have the same mental connection to a patient than you do in the ICU or in the SNF or step down units. They're just different, right? You can't have the same
Mhm.
mentality. So being somebody that is, from your perspective, a nurse and a wife with the experiences that you've had, you can talk to both sides, which is a really cool piece for you.
Yeah, thank you.
Thinking about your business, you did this 8 years ago. How would you describe, or what would you describe as being one of the bigger challenges you've had setting up and being successful in your business?
Well, I mean, I do have an MBA in healthcare management,
Mm,
but starting a business is a whole different ball game than being a nurse and being an understanding clinician. I experimented with different pay models. Experimented with different ways to market myself. I've revised our website. So, and I think the advice that I would give is don't be afraid to ask for help.
hmm.
Sometimes I think as a clinician, I feel pretty confident, but again, you don't know what you don't know. So, partnering with somebody like yourself, Scott, and helping me to grow this business is really important. But when I started
Hmm.
out, I had a little bit of help to create an LLC. Wasn't that difficult. But then what do you do? How do you get the word out there? I can't exactly put a
Yeah.
billboard out on 271 and say, hey, I'm a patient advocate. What the heck is that? Even doing my 60-second commercial in networking events is difficult because what I do is so all encompassing. I have a son who owns a heating, air conditioning, and roofing company. And That's pretty simple, right? I'm not saying the
Well,
business is simple, but
Roberta,
saying what I do,
people know what
right?
the roof is, right? They know what their
Right,
heating and air
exactly. I know
conditioning
what
is.
heating and air conditioning is, and when it breaks down, I call this guy at Map Construction, right? I mean, how do you say exactly all the things that I, as a nurse and an advocate, can do for you in 60 seconds? Like I
Yeah.
say, I can say that I'm a provide expert in nurse-led advocacy, and I always say I don't make decisions for my clients because I don't think that's appropriate. What I do is give them the knowledge that they need and the resources they need and the choices they can make, and then they make the decisions. Sometimes I don't agree with the decisions, sometimes they work, sometimes they don't, but that's not my role. My role is to help them understand all their options and then go with those options that they feel are best.
Well, the idea that you have this experience and knowledge and you do have probably the answer, but giving somebody the options to learn themselves and what's possible, I think that's a better way of doing it. Because if you always stepped in and did what you wanted to do, it might not be what's best for that particular patient and that particular moment in that particular time with that particular family situation, right? So
Yes.
being somebody that is intelligent enough with enough experience, and I like to say knowledge and experience equal wisdom, right? So somebody that has the wisdom that you have to step in and say, here are three potential solutions or options that we have. Let's talk about them. And each
Mm-hmm.
one is going to give a certain amount of ups and downs. Now, what do you want to do? It's up to you to what you want to do, but you have that experience to bring that to the table. Is that a pretty good understanding of how you do things?
Absolutely. And there are so many different things that occur. Sometimes the person is in a nursing home. They don't know that they're going to get what's called a NOMNAC, which means that they're going to get cut. Their insurance company is going to say, we can't keep you anymore. You have to go home. Okay. They don't know that they can appeal. They don't know that if they file it, that about 12%, I believe it is, of people appeal those, and about 80% of the time you win. So you can still stay and get therapy, et cetera,
Oh,
et
wow.
cetera. So some people will say to me, no, I don't want to appeal. I'm just going to go home, even though maybe not the best decision. Another situation is a person diagnosed with cancer. And some people are going to say, I don't want to do any treatment. I just want to live my life. I want to do palliative care. Or some people will say, even though they may have a stage 4 cancer, and a very low chance of survival, they want to do everything. And that's okay
Mm.
too. That's okay too.
Yeah.
And my role, excuse me, my role is to help them through that process to get the resources they need. If it's palliative medicine, if it's hospice care, if it's the best, oncologist and hematologist, and go to those appointments with them. If it's surgery plus all of the above, whatever they need is what I'm there for. And let's say they do have stage 4 cancer, and let's say they beat it. Fantastic. Isn't that
Yeah.
amazing? Or let's say they don't beat it. So now I'm there to help that family through that process, to even help them through that dying process if that's what occurs.
Yeah.
So it's a real roller coaster. As a nurse and as a human being, it's difficult to watch people suffer and go through things, but it's gratifying to get them through what they need to do. I think the other part is I'm a patient periodically. And I think every doctor and every nurse should wear that little silly gown that opens in the back. It really puts, right? It
No, you're
really puts
good.
perspective on how to treat a person as a human being.
Yeah.
I think sometimes we just go through the motions of what we have to do. We start that IV, we get you ready for your procedure, get you ready for your surgery, but making eye contact, talking to that person, touching that person, respecting who they are, learning who they are, that is critical to their
Yeah.
healing.
Well, the bedside manner has been such a lost art. And I'm not just talking about in clinical settings. I mean, it used to be everybody was really good at customer service, and now it's the rarest service that you can find is good quality customer service. And in your space with the clinical side, we're dealing with people that are afraid, that have a
Yes.
really interesting perspective on what's going to happen. And this is their first ever gallbladder surgery.
Yep.
But that nurse has probably prepped 15 people today that's going to have how many different surgical procedures. For her, it's such a benign situation. And I understand how it could become trivial. But every patient or excuse me, every clinician should have to walk down the hallway with that gown open up in the back so they know what it's like to be a patient. They know what it's like to be people. And
Yep.
what I think is the most compelling part of what you do is that human connection. When somebody is afraid, somebody is nervous about what they're going to go through or what they are going to experience in their healthcare journey, you can be that sounding excuse me, that sounding board, that grounding feature where the family can rely on you to be, all right, what do we do, Roberta? What's next? What do we do? And that part of it is the human part of it. And I appreciate what you do for that because that's really cool.
Right. And also, I help to teach nurses to be that compassionate person. Had an experience recently where I went in for a relatively minor procedure. And, I tend to be pretty nervous because I know the negatives that can happen, a little bit of
Mm,
knowledge, dangerous thing. And they put my EKG on, and I could tell I was tachycardic or high heart rate. And, I was anxious. And the male nurse said to me, he didn't look at me, he didn't make eye contact. And I said, "Yep, sorry." I said, I'm a little anxious. And he goes, "Why don't you just take a couple deep breaths?" I just was like, "Oh, that'll do it. Yeah,
yeah,
that'll do it."
smooth it right out.
I was just like, you completely dismissed me. I mean, if he had even taken 2 seconds to just look me in the eye and say, "Hey, I'm here for you. It's You're going to
Yep.
be okay. We're going to take good care of you." And I know that intellectually, I know that. But if he had just, and I'm not saying he's even a bad nurse. I think he was a good, he started my IV, did fine. But you could tell it was just routine for him. It was just rote for
Yep.
him. It was another one of those procedures that was the 20th one he did today. And I get it. I understand it. But and it didn't take much more time just to make eye contact and say, "Hey, Roberta, I'm here for you. We're going to
Yeah.
take good care of you today." Okay,
It,
take a few deep breaths. I literally looked at him and I'm sorry, I got sarcastic. I go, "That'll do it." I mean, I just,
uh-huh.
what are you
But
thinking? What are
here's
you
the
thinking?
interesting point that I think you drive pretty well here. It takes the same amount of time for him to say, take a
Yep.
number of deep breaths versus saying, Roberta, don't worry about it. I got you. Same
Mm-hmm.
amount of energy. The
Yep.
difference is the energy transfer from him to you is I I don't really care. I'm apathetic to your situation. It's no big deal. Versus
Right.
I have a moment now where I can share some empathy and serve with emotion as a customer service representative. I know he's a nurse and I know it's clinical, but take it from a perspective of
Yep.
you're dealing with a human being. And we all
Yep.
want a little bit of empathy and we all want to be connected with emotion. If you can figure that out, yeah, you have a lot of problems solved. I want to ask you, um, what's the biggest lesson you've learned as a business owner? Because you've got employees, you've got different coverages across the region. So what is it that you've learned that, wow, I wish I would have learned that a lot earlier? I mean, you made comment earlier about asking for help. Is there another lesson that really sticks in your mind?
I think while you're running the business, it's you're also trying to get more clients, you're trying to run the business, trying to make sure that you grow the business in a reasonable amount of time and not
Mm.
being afraid to take that next step. I think sometimes I and people are afraid to make a mistake, and it's okay. It's okay. You make a mistake. I mean, you can't make a mistake in medicine so much because somebody can die, but you can venture out, try something new. I think I shared with you some ideas that I have about growing the business,
Yeah.
and you know, uh, reaching out to people that can help you, and if it doesn't work, that's okay. It didn't work. So now you learned a new lesson from what didn't
Mhm.
work. Keep on going and having confidence in yourself. I think a
Yeah.
lot of people have that imposter syndrome kind of feeling, geez, am I good enough to do this? And again, I started out as a nurse, not as a business owner. So that was a venture into cold waters that I really didn't know anything about. Also, not being afraid to network. Networking is absolutely essential. You and I
Yeah.
found one another on LinkedIn and didn't even realize that we lived close to one another. So, getting on social media, finding people, being willing to do things just like this podcast. Some people might be anxious, nervous, not want to speak in front of people. jump into those cold waters and go forward. And if it doesn't
Like
work,
that.
nobody's going to die from it. You're just going to learn a new lesson. And okay, maybe it's a little embarrassing. You spoke in front of people and misspoke. It's fine. You learn something new. You learn
Yeah, I
something new
love
when you
that.
meet new people.
Well, the cold waters analogy is one I haven't heard before, but I really like it. I'm going to steal that just so you know,
Sure.
because I like the way it sounds. But the idea of learning through the lesson as
Mhm.
opposed to I made a mistake. I've always tried to change my client's perspective away from, well, I fail forward. It's okay. Let's not talk about it as a failure. Let's talk about it as we did something, we experienced it, and we learned through the lesson how not to do it for the next time. So we're not failing, we're learning. And I think
Right.
that's a positive mindset change that most entrepreneurs are so fixated, Roberta, on I need to be perfect, I need to have things work, I need to be a millionaire, and they're forgetting how you get there is by step, and a few of those steps are going to be mistakes, and there's no other way around it. But if you're smart enough, you'll learn from those mistakes and do something about it. I'm going to go back to what you said earlier, which is you don't know what you don't know. Fine. If you recognize the fact that you don't know it, you're halfway through the solution, which is go find out how to do it.
Right.
That is one of the most key components to being a small business owner or an entrepreneur that most people think they can do everything. You
Hmm.
can't. And the reason why you can't, because you don't have experience doing it. You're an amazing clinician, but you've never run a business before. You have an MBA, but you've never started a business before. It's different than the books. Not saying the books are wrong, but the books are
Right.
not real life. And you
Yeah.
need to click your heels a few times, get lucky a few times, but roll your sleeves up and get to work. And that's how you make a business successful. And clearly, 8 years in, you're doing quite well. I mean, there's opportunity to have an amazing business that grows and scales with you. And that's what we're working to do. But I look at this as an opportunity to say, all right, I had no idea what I was doing, but look at me now.
Hmm.
That's key,
Absolutely.
right?
And I appreciate your compliment too, because if I would say anything about me, it's that I'm a perfectionist. And when you're a
Mhm.
perfectionist, you can halt yourself and not want to take the next step because you're afraid to make a mistake. And
Yeah.
I've really grown out of that, and am able to ask for help and to seek out people like yourself to help me to grow this business even more. So
Yeah, no, I
appreciate that.
appreciate that, and it's interesting. It's we've come to a conclusion. Thank you so much. 30 minutes has gone by in a heartbeat.
Hmm.
I typically ask a final question. I want to ask you, if I were to put you into a time machine and send you back, and you get a chance to meet 18-year-old Roberta, what's that conversation sound like?
So this is advice to 18-year-old Roberta.
Yeah.
Okay. I would say continue to be a good and decent person, work hard, study hard, um, pursue the profession that you love.
Mm,
Um, what you will do will change lives and save lives, and that's important. Roll with the punches
that's a good one.
and learn from the mistakes and have fun. Enjoy,
I like it.
enjoy life and help people. I always say I want to leave people and things better than when I found them. And that would be my advice to my 18-year-old self.
I like that. I like that.
Good,
Find
good.
leave things better than how you found them. It's a great
Leave
piece of
people and
advice.
things better than when you found them. Yeah.
That's a good one. I want to thank you,
Thanks.
Roberta. A great conversation. I appreciate you sharing your story, knowing
Sure.
how intimate your story is. So I appreciate you spending the time to tell it. And I
Sure.
think the work you do is valuable. And let's make sure that people get a chance to talk to you and connect the dots with their clinicians when necessary. So thank you so much for being on the Legacy Leaders. We'll see
Of
everybody
course.
on the next episode.
All right. Thank